Beauty to me is feeling self-confident, feeling inside like your insides match your outside.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Jen Allen, a board-certified family nurse practitioner, hormone optimization specialist, and the founder of the Renewal Lab in St. Petersburg, Florida. After spending more than 15 years in healthcare, including a decade in emergency medicine, she now specializes in helping women and men uncover the root cause of fatigue, weight gain, brain fog, thyroid dysfunction, hormone imbalances, and metabolic issues. Jen is WorldLink certified in hormone optimization and combines evidence-based medicine with a root cause approach to help patients feel their best at every stage of life. Through her clinical work, educational workshops, and online content, she is passionate about challenging outdated health myths and helping people understand that normal is not always optimal. So Jen, welcome and glad to have you here.
Thank you so much. I appreciate that.
Yeah, so let's start from the very beginning, Jen. What got you first interested in the medical field?
My own health journey. So I was diagnosed with Graves' disease when I was 17 years old.
Mm.
It's a thyroid condition that caused my thyroid to make too much thyroid hormone.
Mm.
And they took my thyroid from me when I was 20. And
Mm.
I did not feel normal after that, not
Mhm.
until I found my own integrative healthcare provider when I was in my 30s.
Wow. Okay. So I guess you had that as the personal journey you went through, but you also started off in emergency medicine. And so did you kind of know from that your health journey that you wanted to be involved in medicine in some capacity then?
Yeah, I did.
Mm.
Yeah. I spent a lot of time around nurses and physicians because of what I dealt with. And
Mm.
that's what got me interested in the ER in the first place. Yeah.
Okay. And then when you transitioned over to, I guess I'll call it the wellness side of medicine, what was that transition like? I guess what caused you to transition? I mean, you dealt with this issue when you were younger, you got
Mhm.
into medicine, the emergency room side, but then what led you to decide that you want to really get into the wellness side?
Well, throughout my career, I noticed that being dismissed by a lot of the traditional healthcare practitioners was not just something I experienced. It was something that was actually very common. And I met some amazing providers in the wellness space. They were integrative physicians and nurse practitioners who actually listened to their patients and actually heard their stories and believed them when they shared their symptoms. And I realized that there was a much better way to do this, that we can learn so much more from patients when we spend time with them and hear them and not rush them in and out of a 15-minute appointment, which is what we're all used to.
Mm. Okay. And then, so this basically led you to start your own business, the Renewal Lab. What caused you to decide to start your own business?
I was, like you mentioned in my bio, I am WorldLink trained, and the learning that there are so few providers out there that are very well trained in hormone replacement therapy just kind of pushed me. I felt kind of called to do
Mm.
that. So I don't think there's anything else I'm supposed to be doing
Mm.
besides helping people with their hormones.
Got it. Okay. So then let's dive into that hormone optimization, hormone therapy. For people who have no idea what that is, could you kind of give the overall idea of what is hormone optimization? What is hormone therapy?
Yeah, so I get people in my practice that are women that are perimenopausal, all the way to men who are struggling with the loss of like testosterone and thyroid hormone. And so what I do in my practice is help them optimize that. And what that means is maybe they're not making any more of these hormones, like in menopause or andropause, or maybe they're starting to decline slowly, but they're not optimal. They're not functioning like they used to. So I collect labs from them and we find out what levels make them feel optimal. And then I adjust their hormones accordingly. And we use my favorite things to use are estradiol, progesterone for women only, testosterone, and then I optimize thyroid for folks also. And that helps with all of these things help with our health, our bone health, brain health, heart health, and of course, metabolism. We can't metabolize anything without our thyroid.
Okay. So you mentioned that regulating your hormones can fix all these other issues, but is something where, let's say, someone is suffering from all these different types of issues, fog, weight gain, mood disorders, things along those lines. But let's say you have somebody who is only suffering from maybe one thing, maybe just sleep disruption. Is the hormone optimization largely going to be kind of the same application and it's going to solve either the one issue you're suffering from or the five issues you're suffering from? Or is it like, is it more of a, hey, I have sleep issues, then you would adjust a certain hormone, or hey, I have weight gain issues, you would just adjust a certain hormone?
Yeah, so we can definitely tailor it. So I like to use perimenopausal women as an example because it's not a good idea to give them estradiol because we're making it, but it's a very good idea to give them progesterone because it helps them, like you mentioned, poor sleep. It helps them
Mm-hmm.
sleep a lot better.
Mm-hmm.
And so we can tailor it to match what they're feeling and also to match what their goals are.
Okay. So now you can also help in this as far as like sex hormones, and I want to dive into thyroid also, but for the sex hormones, is that really about getting your libido back, or is it kind of you getting the sex hormones, but it would also help other areas of your life? So things that you wouldn't really think about. So like if you kind of restore your sex hormones, maybe that helps your sleep, or maybe it helps your brain fog, or is it really very specific to, hey, if you fix the sex hormones, that helps you with your libido?
So I like to think of the libido as like the icing on the cake, right? So like our hormones, especially estradiol and testosterone, are so important for preventing things like osteoporosis. Estradiol is very important for helping keep off or get rid of that visceral fat that we start to accumulate as we age. And estradiol is so important for helping regulate insulin resistance. And then on top of that are the amazing fun side, right? The increased libido or, feeling like you like your partner again or reconnecting with them. So that's why I call it the icing on the cake. So
Mm-hmm.
there's important health benefits to the hormones, and then there's, a fun side to it too.
Okay. Now, on the thyroid issue, since this, I imagine, would hit home to you since this is what you went through when you were younger. On the thyroid side, I guess if people are suffering from thyroid issues, what is kind of the prevailing knowledge? Is it more just like, a, well, you really can't do much and you have to maybe remove your thyroid? Or are there other options out there compared to hormone optimization?
So whether or not we remove somebody's thyroid or kill it, like in my case, it's called ablation, depends on what is the cause of their, excuse me, of their thyroid issue. So mine was an autoimmune issue, and to kill it was what, I was told was the best option for me.
Mm,
I learned later I had other options, but
mm,
too late.
mm,
Um, so it depends on what's going on with the person. Um, One of the most common issues that people face in medicine today is that the providers are checking a lab called TSH, which is thyroid stimulating hormone. That's not an active thyroid hormone, and that lab test can be normal even if things are off.
mm,
And when that's the only lab that's checked and it looks normal, that's usually where people get dropped off by their, primary care provider. They're like, "Well, you're normal, so we're not going to do anything for you." All the while, these people are complaining still that they're tired and they don't have any energy. They're cold all the time. Maybe their hair is falling out or they have dry skin, brittle nails, and things like that. Maybe it can cause constipation, all kinds of things. So finding somebody that can help optimize your thyroid and look at the labs that are really important, the active thyroid hormone, which is T3, is much more beneficial and can help people feel a lot better.
Okay, so there are other options typically for people suffering from thyroid issues.
Yes.
Okay. Now, when it comes, and you talked a little bit about this, when it comes to men versus women, I think if people think about, well, okay, hormone optimization for men, it's just testosterone. For women, it's just estrogen, maybe the progesterone as well. But is that really the truth, or is there more that goes in beyond that?
Yeah, so I like to teach my patients that, look, for women, for example, testosterone is wildly important. We make it. It's a huge part of what helps with our libido. Testosterone helps with confidence. It helps build muscle mass, even in women. And then on the side for men with estradiol, estradiol is still the hormone that is protecting their bones and their brain and their heart. So both are very important for both sexes, but obviously in different levels.
Mm,
And so having somebody that is trained appropriately to make sure that you're getting the doses that you need is very important.
okay. Now, when it comes to men, is there kind of a certain cutoff where testosterone optimization may start helping, or some of these other hormone optimization may start helping? Because I feel like with women, it's, well, when you start hitting the perimenopause phase, and that seems when it's like, okay, you really have to start looking at this and considering this. But for men, is there kind of like age range? Is there just like a certain things they need to be aware of, that, hey, something's happening, I should probably at least get my testosterone levels checked? What should they be looking out for?
Yeah, so men experience what we call andropause, which is like menopause. But a lot of them experience it on a much slower level and a slower scale. So it's a little bit less noticeable. So
Mhm.
men start to experience andropause around the same time that women start to experience perimenopause. So anywhere between like their late 30s to early 40s is when it will typically start for them, and they have a lot of the same symptoms. They will feel tired. They will feel like maybe after their workout, they don't recover quite as quickly as they used to. Or maybe their workout is a lot harder to do, even though they're doing the same thing they've always done.
Mhm.
They also experience brain fog and maybe like a little bit of forgetfulness and stuff like that, like women too.
Mhm. Okay. So actually the symptoms are quite similar between men and women.
Yeah, they
Okay.
are.
Okay. So if they're experiencing those symptoms, then they should at least start looking at hormone optimization as a potential treatment for them. So
Yes.
with that being said, I guess where do they start? Like, let's say that either men or women are suffering from this brain fog, trouble sleeping, weight gain, anything along those lines. Where do they start?
Yeah, so one of my biggest pet peeves when people ask this question, you see experts get asked this all the time, and the expert will say, talk to your doctor. And that's frustrating to me because most of our providers are not trained in hormones. And so my advice always is to find a hormone specialist in your area. WorldLink is where I was trained. It's called WorldLink Medical. And you can look on their website and find providers that have been trained by them in your area. And I think that is the best place to start. That way, you're not getting frustrated, going to your doctor, getting your testosterone checked, and being told it's normal at, 3 or 400, because that's not normal for anyone.
Okay. And are there certain things that, I guess, what are the typical tests that people should kind of be ready for? Is it just a simple blood test, or are they doing other things as well?
Yeah, so most providers who do what I do check a range of labs. We check progesterone in women, estradiol, testosterone in everyone. And then we also look for a hormone called DHEA, which is not very well known, but very important.
Mhm.
And sometimes we'll do thyroid testing, and then I like to look at the whole person and make sure they're all healthy, because it's never just the hormones when somebody's feeling kind of tired. So it depends on the provider.
Okay, got it. And when it comes to misconceptions, I'm sure you've heard a lot of misconceptions. I'm sure you've heard a lot of myths from people out there. What would you say is the most common myths or misconceptions you hear when it comes to hormone treatments?
Yeah, well, there's two. One, everybody is still afraid of estradiol because of the study that came out in 2002, which we've been slowly rebuilding and slowly debunking that study.
Mhm.
And then the other one is that men and women are afraid sometimes of testosterone. They think when they hear testosterone, they think steroids, they think big buff guys at the gym abusing testosterone. And so I like to educate people and teach them that I don't turn people into, Arnold Schwarzenegger.
Mhm.
It doesn't have to be like that. And also those are, synthetic anabolic steroids. They're different.
Mhm.
So there's a difference. I like to educate about the real bioidentical hormones versus synthetics.
Okay. And in that vein of education, how do you approach the educational component to your clients, to your patients, of the benefits of these treatments? Because I'm sure you get a lot of people coming in and they don't know, or maybe they've heard a friend do it, but they've never done it themselves, and they just have no
Yeah.
idea what to expect. Like, how do you approach the educational component with them?
So I love to teach. So I personally offer workshops that I teach here in St. Pete, and I also do some online workshops for folks. I also love to direct people to my training. Dr. Neil Rosier is the one that trained me at WorldLink, and he's has some amazing books about hormone optimization. One of them is called Normal Isn't Optimal, and I highly suggest folks read that if they have questions about the safety or efficacy of hormone replacement therapy.
Okay. Now, I'm sure that, Jen, you've had some maybe particular challenging cases you've worked on in the past, or maybe even memorable cases. Is there maybe one story that comes to mind of just one of those memorable cases and how you were able to get them a successful outcome in the end?
Yeah, I have a younger patient actually that I worked with very recently who was very frustrated because she had been told by a handful of providers, even hormone specialists, that they could not help her because she was very sensitive to oral progesterone.
Hmm.
Um, and she found me just by chance through a Facebook post and came to me, and I was able to educate her about the different types of, the different ways we can get progesterone into her that would not cause her to feel the way that she was feeling. And I made the mistake of thinking, that that was very common knowledge in the world of hormones. And I learned that it's not. And that's why I really stress, looking for a hormone specialist that is trained, has many, many hours of training in hormone replacement therapy. So I was able to get her a form of progesterone that she could tolerate. And now she can take all of the hormones and she's doing it safely and feeling much, much better.
Okay. Now, within that vein, you kind of talked about, well, she was taking the oral version of it and it was not doing well for her. So, can you talk about some of the other methods that you can get hormones into your body? I know there's like topicals, there's injections, all these different things, or even pellets. Um, Across all of them, is there one that's better than the other, or is it more just of a, hey, this one's the one that's best is the one that you're actually going to do, or is it more of a, well, it depends on the person? Like in this case, maybe she couldn't do oral, but maybe she can do topical. So, like, I guess what's the different methods and what's the, I guess, is the one that's better than the other, or is it really kind of tailored to the individual?
Yeah, so I have my favorites that I believe work better at certain things. For example, I'm a huge fan of oral estradiol, and I know that a lot of people are a little bit afraid of that because of like the WHI study that I mentioned before. But the safety profile out there is showing us that it's very safe.
Hmm.
That being said, my preference is that my patients get the hormones in them. So if I, give you a testosterone injection and you go home and then you're like, I'm not going to give myself shots every other day. Like this is silly. That's not going to work for you. So maybe a cream works best for you. Um, so I like to work with my patients and figure out, how are they going to get the hormones in them so that they get the benefits from them? And then we go from there.
Got it. Now, where do you think the future of wellness is going?
I see a huge, I don't know, there's going to be, I think, kind of a line drawn in the sand. I see a huge shift to more concierge type medicine, people doing a lot of similar things to what I'm doing. But there's another side of that where some people can't afford to do that. So I really hope that insurance companies are going to follow the concierge method and that people will start to get to spend more quality time with their healthcare providers and get the care that they deserve.
And with the future in mind, what is the vision for your practice?
My vision is to have more than one location, not just in Florida, but along southeastern side of the United States. And so that's my goal in the near future.
Excellent. Well, Jen, I do have one last question for you, but before I ask it, I do want to point people to your website at the-renewal-lab.com. Now, last question for you. What does beauty mean to you?
Oh, beauty to me is feeling self-confident, feeling inside like your insides match your outside.
Okay. Well,
I think, yeah, confidence just makes people glow.
Well, there you have it. Jen sharing her expertise. So, Jen, if people want to learn more about what you do, what's the best way for them to contact you in your practice?
Yeah, there's a contact me form on my website. I love interacting with people on Facebook and on TikTok also. I do lots of videos on TikTok. So I'm always happy to answer questions.
Okay. Well, Jen, this is great. Thank you for coming on and thank you for sharing your message.
Yeah, thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.